Welcome to Raaonline. Today we have a very important topic, the phosphorus toxicity. Okay. In my PG days, when I attended a mock practical session in one of the leading medical college and hospital in Vellore, one of my friend got this as his exam topic. Okay. So answering a topic in a theory is different from answering a topic in your practical session. Okay. In practical session, they'll be asking you real time how will be handling this patient given the various other medical issues with that particular patient is. Okay. So today we'll see in depth about how to handle a phosphorus toxicity. On the first place, why is a skull image put up at the background? Okay. So how that skull image is related to this phosphorus toxicity, and you can very well see that this area of some mandible also is destroyed. Okay. Whether this side is not destroyed, right? So how come this destroyed mandible is related to phosphorus toxicity? We'll go into the topic. So phosphorus is a non-metallic essential element discovered hundreds of years ago. So now you tell me what all you know about phosphorus. This is a metal which has been non-metal which has been discovered hundreds of years ago. And moreover, the exam question which we got is on yellow phosphorus. So after we started reading, we come to know that it exists in three forms: white, red and black. There's nothing called as yellow phosphorus on the first place. Okay. So it exists in three forms: white phosphorus, red phosphorus and black phosphorus. Then what is that exam question? What do you mean by yellow phosphorus? Okay. So understand this red and white phosphorus are interchangeable by some chemical reactions. Okay. So when you create a white phosphorus, some impurities, some contamination with the red phosphorus exist. So like 98-99% of white phosphorus is minimal red phosphorus within it is called as yellow phosphorus. Okay. So these are the 3+1 type of phosphorus. So if they ask you an exam, how many forms of phosphorus exist? It's actually 3: white, red and black. Yellow is nothing but a combination of white with some contamination with the red. So phosphorus literally means light bearer, the property of glowing when exposed to air. Okay. So if it is not exposed to air, it will not glow. Okay. So why I am telling you this is very, very important, right? So because once you put a Ryle's tube in a patient, how will you confirm the Ryle's tube? You inflate air, right? But if there is a phosphorus inside that particular person's stomach, then if you inflate air, then you're going to induce a chemical reaction there. So in this point, I'm trying to tell you, if you are seeing a phosphorus patient and if you are putting a Ryle's tube, do not confirm it with inflating air. Rather, you can use some normal saline and try to check the position of an RT. Okay. So phosphorus means light bearer, property of glowing when exposed to air. The uses being luminescent and pyrotechnic. Okay. So it is used in matches and fireworks. It has toxic properties, so used in rodenticide also. Biologically, it is present in the living organisms as phosphate ion. Okay. So phosphate ion is completely different form of phosphorus compared to an elemental phosphorus. Okay. Increase in phosphate in my body doesn't mean that I have consumed phosphorus. Understand this. Okay. So I see a chronic kidney disease patient and the phosphate level is very high. That doesn't mean that he has consumed phosphorus. On the other way around, a patient who has consumed phosphorus, a phosphorus toxicity, patient is coming to you, need not be an increased phosphate in that patient also. Okay. So these two are totally two different forms of phosphorus. Okay. So history and epidemiology. At the beginning of 20th century, phosphorus was used in millions of strike anywhere matches. Even in movies, you would have seen this, right? They will take up a stick and they will light it anywhere. They will strike it anywhere. Okay. That's called as Lucifer matches. These are the matches. Okay. So basically, the head contained phosphorus. Okay. It's basically a white phosphorus coated with a minimal layer. So when you scratch, whatever the outer layer is there is breached. So white phosphorus is put out in the air, it starts